Hi everyone, welcome back. We're going to continue with our USMLE series. We started with pathology. So today we're going to be talking about cellular injury. So let's start with a question. A 58-year-old man presents with chest pain that radiates to the left arm. We did an EKG that showed ST elevations in lead 2, 3, and AVF. So that sounds like inferior wall MI. A coronary artery is completely occluded. Which of the following is the earliest cellular change caused by this type of injury? So this patient has a form of hypoxia cellular injury as a result of the occlusion of the blood vessel. And what the question is asking us is, what's the earliest cellular change we're going to see in this patient? And then looking through the option, I think the best answer here will be mitochondrial swelling, so cellular swelling. So let's see why. So we're going to talk about, so today we're going to be talking about cellular injury. So starting with cellular injury. So under cellular injury, a lot of things could lead to cellular injury. Hypoxia is part of them. Radiation is part of them, right? But for the infection, right? But for the purpose of today, we're going to focus on hypoxia cellular injury. So by definition, what's hypoxia? Hypoxia is decreased oxygenation of the tissue. And anoxia, on the other hand, is complete absence of oxygenation of the tissue. So when you have complete absence of oxygenation, that's anoxia, but decreased oxygenation of the tissue is what we refer to as hypoxia. And the hypoxia is the most common cause of cellular injury. Like we mentioned earlier, a lot of things could lead to cellular injury, but out of them all, the most common is hypoxia. And why is hypoxia a big deal? Because if there is no enough oxygen, we know that oxygen is required for oxidative phosphorylation to be able to make ATP. Because oxygen, if you remember in the mitochondria, in the electron transport chain, oxygen is the final electron acceptor in the electron transport chain in the mitochondria. So if there is no oxygen, then you can't make ATP. And the ATP is an important essential energy source in our body. Almost virtually everything in our body needs ATP. So moving on. So when we look at hypoxic cellular injury, we divided them into two. We have the reversible changes that we can see, and then we have the irreversible changes. So here we're going to start with reversible hypoxic injury. So what's reversible? So reversible cellular injuries occurs when the hypoxia, which is decreased oxygen delivery, causes metabolic and structural changes that can recover if oxygenation is restored before critical damage. So if I can restore that oxygen, all those changes that I'm seeing, if they are reversible, then those changes are reversible hypoxic are what we're going to see in reversible hypoxic injury. So let's look at those changes. So to better understand those changes, it's going to be a good idea to look at what the cell looks like, right? And I'm sure you guys have seen this picture a lot. So let's say let's say that's the cell, and inside the cell you're going to have what? You're going to have a nucleus, right? And inside the nucleus you have the genetic information, right? And in addition to that, you're going to have your rough endoplasmic reticulum, right? And then on top of the rough endoplasmic reticulum, you always have some of ribosome that are bound to it, right? Remember, when you look at the ribosome, we have some free ribosome, right? And you also have some ribosome that are bound to the rough endoplasmic reticulum. And those ribosomes that are bound are very important to produce protein that you're going to export out of the cell. So that's going to be our rough endoplasmic reticulum, and it is going to be the nucleus. In addition to that, we also have lysosome somewhere here, right? So we have our lysosome, and then lastly, we also have the mitochondria, right? Which is where we make our ATP, right? And when you look at the cell, right, the main cations, right, that are inside the cell are usually potassium. So your main cation inside the cell is potassium. Whereby outside the cell, right, your main cation is going to be what? It's going to be sodium, right, outside the cell. And then for no reason, if potassium goes out of the cell and the sodium go into the cell, then God puts a pump there. And that pump could help to take those excess sodium out of the cell and bring those potassium back into the cell. And then because this pump are going to be taking those cations against the electrochemical gradient, so they're going to need energy. And that source of energy is going to be what? ATP. And then this pump is going to be what? Sodium, potassium, ATPase. So this sodium, potassium, ATPase, right, is going to be taken out 3 sodium, so we want to take out 3 sodium out of the cell, right, in exchange for 2 potassium, right? So that's sodium potassium ATPase. So let's go through these steps of this, what we see with irreversible hypoxic injury. So if somebody have hypoxia, like we said, they want to be decreased oxygen delivery to the tissue, and as a result of that, that will lead to decrease in ATP production, right? And because of the decrease in ATP production, that means this pump is going to stop working, the sodium potassium ATPase, because there will be no ATP to be able to power the pump. And if the pump stops working, then sodium is going to accumulate inside the cell, right? We can't take the sodium out. And anywhere sodium goes, what follows? Water follows sodium. So now we're going to have sodium accumulate inside the cell, and the water follows, and that leads to cellular and organelle swelling. And what are the example of organelle? Same thing that we just mentioned, right? Your mitochondria, your endoplasmic reticulum, your Golgi apparatus, right? Those organelle are going to what? Are going to swell up. And this is the earliest light microscopic changes, which goes back to the question that we saw earlier that asks us about what's the earliest changes that we see with hypoxic cellular injury. So the answer there would be what? Would be cellular swelling. So cellular organelle swelling. And the cellular swelling also causes the cell membrane to project out. So as the cell continues to swell, if you go back to our diagram, right, as the cell continues to swell and along with the organelle, so now the cell membrane can now be what? They could bulge out, right? Which is what? We call them cellular blebbing, right? So cell membrane causes the cellular swelling causes the cell membrane to project out, which is what we call membrane blebbing. And the loss of microvilli and the intramembranous particle could also be seen. So moving on to the next one. So as the cellular swelling continues, remember we mentioned that the organelle inside the cell are going to swell up. And then one of them is also endoplasmic reticulum. So due to lack of ATP, the endoplasmic reticulum is going to swell up. And that will lead to detachment of the ribosome from the rough endoplasmic reticulum. And then because of that, all those proteins that we need to export out of the cell will not be able to produce them. And that will lead to decrease in protein synthesis. And everything that we've been talking about so far, guys, they are all reversible cellular changes. And then lastly, if there is no oxygen, because if you look at the glycolysis pathway, right, you go from glucose, right, and then you go to pyruvate. And ideally, your pyruvate will be converted to acetyl, right, CoA. And in a normal day, right, this acetyl CoA is supposed to go to the TCA cycle, whereby we can use it to make what? ATP, right? Whereby we're going to use to make energy to be able to use to make ATP in the mitochondria. So if there is no enough oxygen, right, if you don't have oxygen, then this is not going to be possible. So now one of the fate of the pyruvate is that this pyruvate now will be shunted to production of what? Lactic acid. So cells relies on anaerobic, so now they will now be doing anaerobic metabolism, whereby because of lack of oxygen, so they will not be able to go into the TCA cycle. So this will lead to decrease in glycogen production and an increase in lactic acid. And because of increase in lactic acid, that will decrease the intracellular pH, right? Because of the acid. And because of decrease in intracellular acid, that will cause the chromatin inside the nucleus to clump together. So when you look at them, they clump together, right? And that's going to be the last changes that we're going to see with reversible reversible hypoxic cellular injury, right? And then remember, acid denations. So that's reversible hypoxic cellular injury. So now we're going to move on to the irreversible hypoxic injury. So the irreversible hypoxic injury occurs when oxygen deprivation causes severe ATP depletion. And then now there's a membrane damage. Whenever you see cell membrane permeability damage, those are signs of irreversible hypoxic cellular injury. And the cell cannot recover even if oxygen is restored, right? So let's look at this step. So like we mentioned earlier, if there's hypoxia, there's decreased ATP production. And then like we mentioned, sodium potassium ATPase fail, that will lead to cellular swelling. And this one, like we mentioned earlier, is what? Reversible, right? So if you do something on time, if you restore the oxygen, this one is reversible. But now, if this calcium ATPase is not involved, that's where the problem comes in. Because the job of the calcium ATPase, right, is to help to pump calcium out of the cell, because you don't want too much of calcium. Once calcium do what it has to do in the cell, maybe to help with contractility, right, or to help with vasoconstriction, once it finish doing what it has to do in the cell, you don't want too much of calcium inside the cell. But now, this pump calcium ATPase that normally takes the calcium out of the cell, now if you don't have enough ATP, you'll not be able to power that pump. and that will lead to impairment of calcium ATPase, and that will lead to increased intracellular calcium, and this is a bad news. So with the calcium ATPase pump, that normally pump calcium out of the cytosol, and that will lead to, like we mentioned, that leads to too much of calcium inside the cell. And guess what? This calcium could activate anything. It could activate any enzymes, and that's what's to cause this problem. So now we have massive calcium influx, right? They are not going to leave the cell, right? And this calcium now, so they enter the cytosol from extracellular space, they enter the mitochondria, and guess what calcium is going to do? It's going to start activating phospholipase. So by saying phospholipase, something that could break down phospholipid. And where do we have phospholipid? They are present in the cell membrane, right? And also activate proteases. So that means it can break down any protein inside the cell. It's going to activate endonucleases, right? Endonucleases is going to break down all the components of the nucleus. And it can also activate ATPase. So that means ATPase is an enzyme that is going to be breaking down those ATP, and that will lead to further depletion of ATP. So all this activation will lead to membrane phospholipid breakdown, cytoskeleton damage, and the DNA fragmentation. All these are irreversible, guys. So let's start with the mitochondria. So like we mentioned earlier, right? So when you have the cell, right, and now you have the mitochondria inside the cell, right? So now that there is damage of the cell membrane of the mitochondrial membrane, right? So now, because of the permeability, what's going to happen? Number one, you're going to lose what? You're going to lose the membrane potential. And if you lose membrane potential from the mitochondria, that means there's going to be problem making ATP. I mean, guess what? These patients already, they have low oxygen, they can't make ATP. Now there is permeability of the mitochondrial membrane. Now we're losing those membrane potential. So guess what? That will further lead to decrease in ATP production. And then the other one that's going to happen that I'm always scared about most, right? There is a chemical inside the mitochondria. That chemical only comes to the cytosol whenever it wants to cause cellular death, whenever it wants to trigger cell death, right? And that chemical is called cytochrome C. But guess what? Now that the membrane of the mitochondria is permeable, guess what? That cytochrome C now has the opportunity to come into the cytosol. And guess what? This cytochrome C is going to activate what? Caspases, right? And that will lead to what? Apoptosis, which we're going to talk about later. And then moving on. So now we're moving on to cellular membrane damage. So with the plasma membrane, so there's loss of integrity, and enzymes that are supposed to be inside the cell, now they're going to escape into the what? Into the blood, right? So if we are talking about liver, right? So those AST, ALT that are in the liver, they're going to escape into the blood. If you are talking about the heart, right? So if this hypoxia is taking place in the heart, those CKMB troponin, they're going to escape into the what? Into the blood. And that's why if patient is coming into the hospital and they're having left-sided chest pain, they feel like elephant is sitting on their chest, the pain is radiating to their jaw, and we're thinking, is this patient having heart attack, right? What do we check for? We check for troponin CKMB. And while we're checking it, we're looking for cellular injury, right? We're looking for if the cell has been injured. So lysosome. So what about if lysosome is affected, right? Guess what? This lysosome houses a lot of hydrolytic enzyme. This hydrolytic enzyme, they could digest anything. So those enzymes will be released from the lysosome, and those enzymes could digest cellular components, and that could also lead to what? Cell death. So, and what about in the nucleus, right? So the nuclear changes that we're going to see, right? So now, right, we're going to see pycnosis, whereby there's a nucleus, the nucleus starts to shrink, right? And there's also basophilia, right? And with time, then we start having what? Karyoesis, whereby you start to fragment those what? Nucleus. And the last one is karyolysis. So that's where those fragments start to fade away. So there's a fading away, and there's a dissolution of those nucleus. And that's the progression of the changes that we see in the nucleus. So pycnosis, karyoesis, karyolysis, and all these, they are irreversible cellular change. So these are the hallmark of irreversible cellular change. Once you see this, there's no going back, guys. The cell is dead. So now moving on to the next part. So what are the markers of cell death? So this marker of cell death, depending on which tissue or organ is damaged. So the permeability of the membrane causes release of enzymes that are inside the cells into the blood. And guess what? These are what help us to know which cell is being damaged in a patient, right? When patient comes to the hospital and we suggest maybe there is, thinking maybe there's a particular organ that's involved, maybe it's the pancreas, maybe it's the liver, maybe it's the heart, we check for this in the blood to see if patient is having cellular injury. So this enzyme can be measured in the blood, thereby facilitating making a diagnosis. So the first one is in the liver. So if there's liver injury, you can check your aspartate aminotransferase or alanine aminotransferase. If it's cardiac injury, you could also check AST. You could check creatine kinase, MB, right? MB subtype, right? You can check your cardiac what troponin, like high sensitivity troponin. If it's in the pancreas, right, you can look for lipase and amylase. But remember, lipase will also come from where? From the salivary gland. And if it's skeletal muscle injury, you're going to be checking your creatine kinase. But remember, this also be MM. So MM come from the skeletal muscle, whereby your MB come from where? Cardiac muscle. And of course, if saliva, you can also check what? Amylase. Remember, like we said, amylase will come from the pancreas. So the one that's specific for pancreas is going to be lipase. And with general hypoxia, you can see increase in lactate dehydrogenase. Why? Lactate dehydrogenase, like we mentioned earlier, is the enzyme that is converting pyruvate to lactate. So that's why that's going to be increased. So, and I think we've come to the end of hypoxic cellular injury. So let's do some questions to make sure we understand hypoxic cellular injury. So the first question: a 62-year-old man develops chest pain while shoveling snow. EKG shows ST depression. So there's some ischemia going on there, consistent with subendocardial ischemia. Because if you see ST elevation, then you're going to be concerned about what? Transmural, right? So transmural ischemia. Which of the following features could indicate that myocardial injury is still reversible? So now they're asking us about what do we see with reversible cellular injury. So what I'm looking for something that appears as what? Cellular swelling. So I think the best answer here would be what? Cellular swelling with intact membrane. Because once you start seeing things like rupture, increased calcium, nuclear fragmentation, leakage of cytoplasm, these are all irreversible, guys. Moving on to the next one. A tissue biopsy from an ischemic area shows enlarged cells with clear cytoplasm. So the cell is big, right? So it looks like there's a swelling going on. And when we look inside it, it's clear cytoplasmic vacuum, but the nucleus is intact, right? So there's an intact nucleus. Which of the following best explains this finding? I would say this is still reversible, guys. It's still reversible. So we're going to look for reversible changes, right? So leakage sound irreversible, permeability sound irreversible, right? Nuclear fragmentation sound irreversible, and I think the best answer there will be failure of sodium potassium ATPase, because like we mentioned, if sodium potassium ATPase is not working, sodium cannot leave the cell, sodium gets stuck in the cell, water follow where sodium goes to, and that leads to what? Cellular and organelle swelling. Next question. A 58-year-old man presents with acute chest pain. So chest pain. EKG shows ST elevation. So this sounds like what? A transmural ischemia. And a coronary angiography reveals complete occlusion of the LAD. Remember, LAD is the most common coronary branch that is being occluded, right? So if somebody has heart attack, it's always the most commonly occluded. Which of the following findings indicate cellular injury has become irreversible, right? So irreversible. So let's see, guys. So I think I have to look for something like permeability, like rupture, something that has to do with calcium or fragmentation of the nucleus. So let's see, swelling, no. Cellular ribosomal detachment, no, that's reversible. Cellular swelling is reversible. Chromatin clumping is reversible. I think the best answer there would be what? Plasma membrane rupture. Let's look at the next one. Which of the following molecular events most directly causes irreversible death during prolonged ischemia? So they asking us irreversible. So then we have to look for irreversible changes. So let's go through it again. So failure of sodium potassium ATPase, that sounds like reversible. Detachment of the ribosome, that sounds reversible. Decreased glycogen, that sounds reversible. Clumping of the nuclear chromatin, that sounds reversible. I think the best thing is has to do with calcium, guys. Intracellular calcium activated phospholipase activity, because that's what is going to start digesting those phospholipids in those membrane, and that will lead to permeability. And let's do the last question, guys. We're almost there. A patient with severe hypotension develops elevated AST, ALT. So that means that there's something being injured somewhere, and that sounds like the liver. What events at the cellular level best explain this finding? So for me to start seeing this in the blood, that means the cellular membrane is permeable, and it's going to be an irreversible cellular injury. So I think the best answer there will be what? Cell membrane disruption. So there is a cell membrane permeability, thereby allowing those enzymes to escape into the what? Into the blood. And I think we've come to the end of today's lecture. And please, guys, don't forget to subscribe, follow us on our social media platform, and I will see you guys in the next video.